talking about healthcare today, and which plan do you support? Obamacare or the Affordable Care Act?
The Affordable Care Act.
And what is it about Obamacare that you do not like?
I just think that there's a lot of holes in it, and it needs to be revamped. I think
And you think
hasn't been thought out.
You think the Affordable Care Act is a better plan than Obamacare?
Better, but I'm not happy with that either.
What do you agree with, Obamacare or the Affordable Care Act?
I'm more sort of towards the Affordable Care Act, but I'm also very sympathetic for people that don't have the ability to have proper medical insurance.
So the Affordable Health Care Act is still a better option than
Yes.
Obamacare?
Yes.
You gotta love Jimmy Kimmel. That was funny, right?
Funny. An informed public is important.
I know. Okay. Politicians are still fighting on Capitol Hill, folks, and a lot of it has to do with the Affordable Health Care Act, aka Obamacare, is now in place. Everyone still has a lot of questions about Obamacare, especially me. So we want to help you out by answering some of those questions. I'd like to welcome now Bill Hammett, president of Hammett Health, Inc., and he's here with everything you need to know. Break it down, Obamacare. Just break it down.
Everything you need to know.
Yeah.
The idea was to lower costs and increase access, and I think what we're going to see is the opposite of both.
Isn't it funny that a lot of people don't realize affordable health care is Obamacare?
Yes,
It
is funny.
Crazy.
The funny part is the first word in Affordable Care Act is affordable, and yet we're seeing already a lot of the rates have been released for the exchanges, and it's looking anything but.
Okay, so break it down, because I have so many questions, but just summarize what this is for everybody, because a lot of people haven't done their research. Some people have, but I would say the majority has not.
So the Affordable Care Act expands coverage. It makes coverage guaranteed issue. So one of the big problems where people were being declined coverage when they apply for it. Because of health issues. So the biggest thing is it makes it guaranteed issue for everybody. That's a good thing. That's something that we can all get behind.
Okay, but wait a second. If you're, like, let's say you had a surgery of some sort, now you're guaranteed health care coverage, which before other insurance providers didn't want to pick you up unless you were an employee somewhere. Even though you're guaranteed coverage, you're going to pay a higher premium.
You're going to pay a premium for your health plan. Now, people that make below 400% of the poverty level, which is about $40,000 for an individual, about $92,000 for a family, are going to get some level of subsidies.
Okay.
But the premiums are a little inflated to start with, so whatever your subsidy is, it might not cover as much as you think. Our phones are ringing off the hook asking for the free health plan that just came out.
People think it's free?
Most people think it's free. They want that health plan. They want the Obamacare plan, and it's anything but free.
Well, who gets the free coverage? You have to pretty much be destitute, right?
You've got to be up to 138% of the federal poverty limit, which is about $15,000 a year for an individual. If you are that, you're going to get the free Medicaid plan. If you're above that, you can access the exchanges on an individual basis, or your employer can provide you coverage, but it's not free.
Socialized medicine?
It could get that way. The conspiracy theorists would say that's the way we're going.
Yeah. It's kind of like nudging that direction.
It's nudging. My biggest fear is because of some of the way the rating factors happen, younger people are going to pay a little bit more than they maybe should. Older people pay a little bit less.
Why is that?
Because
older people have a less of a shelf life. Their expiration date is coming?
Yes. Well, actually, because they want to make it so that the differentiation between the lowest price and the highest price is a 3-to-1 margin. Right now, it's about a 5-to-1 margin. This means younger people, which are critical to the success of healthcare reform, being in there, clean dollars, healthy people paying premiums, are going to pay more than they should. So
they didn't know that when they voted in this, did they?
They did not.
I don't think they got it. So dollar-wise, let's talk about someone younger. Give me an age.
So your 25 to 35-year-old population, their premiums are going to be similar, a little bit more than they are now, but the big deal is their out-of-pocket expenses, the deductibles they're hitting with. So how much do they pay out-of-pocket for services? The hospital, say, the surgery, is there limits on doctor visits? So there's going to be a lot more costs associated with accessing care. And if you can't even access care because the limited network of doctors is going to also be an issue.
Yeah, I guarantee you they didn't get it. They didn't get that they were going to carry some of the brunt of these costs. Okay, so that would be the younger. What are they considered an older group?
An older group, you're talking 50 plus, 55 plus.
Shoot, I'm not there yet.
I think it's going to happen. We're all getting there.
I know, but not this year.
Good.
Not in the next few years. Well,
So for the older population, we're going to see some premiums that might feel a little more fair to them. But same thing, deductibles and out-of-pocket maximums are going to be a little bit higher than they'd like to see. That's the hidden cost in all this. How much am I going to pay when I go and get my care?
so it's really helping poverty line people and maybe elderly or senior citizens?
You know, the big winners in this thing are people under 138% of federal poverty limit. They're going to get free health care. They're going to get free health insurance.
Didn't they get that with Medicare before?
Yes, but it was Medi-Cal, and it was up to
Yeah.
100% of poverty. So the expansion got another 38%, higher, so you can make a little bit more and still get free health insurance, which is different than health care. Just because you got a card doesn't mean you got health
So
care.
explain that, break that down.
So the Affordable Care Act is supposed to add 30 million new people to the insured rolls. There is no new doctors coming into this. So the basic tenets of supply and demand tell us that with more demand and less supply, it's going to be harder to access care. So the big deal is going to be access. Pre-Obamacare, the biggest deal was affording your health plan. In a post-reform world, who do you see? How many doctors are in the network? And some of these networks.
So not all the doctors have to be in this network. How do they choose which doctors?
The insurance companies put forth contracts. They put them in front of them and say, "This is what we're going to pay you, and if you don't like it, too bad." And a lot of them say, "We can't operate on that level."
So they can choose to opt out, these doctors?
Yeah.
Because you see, even now, doctors will say, no, I'm a cash base only.
Absolutely.
So they can still do that.
Absolutely. So,
And the best doctors will probably do that. And people with the money will be able to go to those expert doctors.
exactly. So
Or the reputable doctors.
So we're seeing what was supposed to bring the population and the access to care further reduce that divide. We're seeing it expand it because the haves are going to continue to have the ability and the funds to pay for their access. So you're going to hear some stuff about concierge medicine. You're going to hear these ultra private PPO networks people are paying into, and then the middle class people are going to have to pay for their health insurance. They're not going to have free care. They're going to get some subsidies, but the network of doctors available to them is going to be a challenge.
And, oh man. And I feel sorry for doctors
Yeah.
because they're going to be making a lot less money. What incentive is it for them to go into medicine?
Well, the ones that are already in, they're in. They've
Right.
made a
I'm
commitment.
talking about the new- we need new
ones.
doctors coming up the
We
pipeline.
need new doctors coming in, and
Yeah.
why would you spend all those years in medical school and come out $300,000 in debt just to go into a field that the government's telling you how much you can and can't make and who you can and can't see? And further than that, a lot of this legislation controls how they treat you. And so they want to decide what the one best way. There's something called the Patient-Centered Outcome Research Institute, which is supposed to develop the one best way to treat a knee surgery, hip replacement, a heart attack.
Oh my, to cut costs.
To cut costs, rationing of care.
Oh, so then it's going to be patient care in a box, and we won't be thinking outside the box
Yeah.
for healthcare anymore.
Patient care in an ATM. You can just go, this is what you get for a knee replacement or a hip surgery, or if you get to be this old, you can't have that care.
That is so sad.
Yeah.
What about, is there any perks to this?
Well, I guess the small business side of it, individual health plans, there's three different type of groups of people. Individuals, this is how you get your coverage. Small business, 2 to 50 employees, and then big business, 50 plus. The 50 plus are going to see the least amount of impact because they're bigger, they're going to be a little bit more insulated through some of it. Individual health plans will see the largest increases because this is a product that now is guaranteed issue regardless of your health. So you're going to see the biggest issue there. And then small business is going to see, on the whole, a more competitive balance between individual plans and group plans, not because group plans are getting cheaper, but because individual plans are getting more expensive. So the employer-sponsored care for the small business is likely to be a little more attractive than it has been in the past. That's the best spin I got for you.
Okay, how much do you think, I'm a single mother of 4 daughters, what can I expect?
Okay, so that's a very important thing. So there's a new term called dependent level rating. Okay, so right now there's basically 4 types of ratings. There's individual plus spouse, individual plus kids, kid or kids, and then family. Dependent level rating says now they're going to rate you as the applicant, your spouse at whatever age they are, and if there's no spouse, and then the kids, they're going to rate individually one by one. So if you have 3, 4, 5 children, you're going to see much higher increases than others because they're going to charge you for each one of those kids. Speechless. It's okay. It's okay. If you work with a licensed health insurance professional, they can help walk you through this. They can help you find the best bad idea. We got the best bad ideas on the market. You better believe it. Just come see us.
We'll be right back. Pat me on the back. Pat me on the back.
It's okay. We'll be all right.
Coming up.